All right, what does this boom have to do with this patient? So she's a 70-year-old woman. She goes to the emergency department. She's got a history of osteoarthritis like every 70-year-old woman, and she has confusion and dry mouth and difficulty reading for the past couple of days. Over-the-counter medicine, she takes a sleep aid. Boom, she took this. Now, what is this going to cause? Well, on examination, her pupils are dilated, sluggishly reactive to light, and her skin is dry and her bowel sounds are decreased. Neurological exam is normal, but she's got impaired vision. So what is going on with her vision? So what we got to talk about here is antihistamines. So we got these anticholinergics. She took this thing. I think it says she took diphenhydramine, and that's what I just Googled here. Went to shopping, and now you can see what this looks like. Okay, so she took that, and these are your antihistamines, right? And so when you take these first generation antihistamines, they're designed to relieve your allergic symptoms by releasing histamine from the cells. It causes rhinorrhea, itchy nose, and urticaria, which is like your hives. You break out in the hives. So first generation antihistamines have side effects. The blockade of other receptors like your alpha adrenergic, serotonergic, and your cholinergic receptors. Now what we need to know about the eye is that it's under parasympathetic control of the ciliary muscle, right? So the contraction of the muscle reduces the tension in the fibers. So now the fibers can relax, and what happens? They become like a sphere. And it's very nice. And you can increase your refractive power because of the parasympathetic input through the zonular fibers. So now you're chilling, you got some refractory power because of that parasympathetic kind of control. And so if you take these antihistamines, it'll cause some problems with accommodation. They're going to be limited, and so you're not going to see, it'll be blurry vision for things that are close up because you can't focus on them because that Edinger-Westphal nucleus, which is under parasympathetic control, which controls the zonular fibers of by the ciliary muscle, is going to be damaged, and so you can't see things really that are close to you. And so anyways, that's what's happening here. And so it's going to be the parasympathetics that are going to be messed up, okay? And then acetylcholine is your parasympathetic kind of transmitter. I forget the mnemonic I have for remembering that. But yeah, so acetylcholine. And so if you inhibit these histamines, like if you, for instance, give a first generation antihistamine like a diphenhydramine, then you have anti-muscarinic, anti-alpha adrenergic, and anti-serotonergic effects. And so let's look at this question here. Inhibition of the parasympathetic input to the ciliary muscle. That's going to be great. Yeah, her eye muscle can't focus because the nerves are blocked. That's what that's saying, right? So it's correct. And so yeah, that's the sleep aids, allergy pills. It blocks the parasympathetic Edinger-Westphal nucleus and causes the zonular fibers to not be able to do their thing so that you can have a spherical eye and see things up close. And other clues, dry mouth, confusion, big pupils. These are signs of your anticholinergic effect. Anticholinergic means you're inhibiting the physiological action of acetylcholine as a neurotransmitter. And so other choices are wrong. B, let's see. Affecting, I guess, like sleep, not vision. So if we look at B, it says suppression of the histamine in the lateral hypothalamus. So antihistamines cause drowsiness. You'd be tired, not visual symptoms. Histamines would promote wakefulness, right? So that's what we need to know about B, and that's why it's wrong. Leukotriene receptor antagonism in the conjunctiva. So leukotrienes can cause allergic symptoms like redness and tearing, but they have no role in accommodation. It's all about the accommodation of the ciliary muscle. And so it's not going to be that. Inhibition of the aqueous humor outflow, that would be like, you think of like glaucoma, and that would worsen glaucoma, but here it's just the near vision. That's all we can't do. Whereas the intraocular pressure would have to be super high, and there's no signs of glaucoma in this question. Antagonism of the alpha-1 adrenergic in the ocular vessels, that causes, if you antagonize the alpha-1 is a constrictor, so it will vasodilate, and that would result in hypotension and nasal congestion, and it has nothing to do with accommodation. So what does first aid tell you that you need to know about this? Okay. So first-gen antihistamines like diphenhydramine and also antimuscarinic effects are going to be seen with antimuscarinic effects like dry mouth, urinary retention, and also blurred vision. It's the opposite of you have the muscarinics, right? Your dumbbells kind of stuff. So like the profuse, you'd have a super wet mouth, a lot of saliva, a lot of the urinary would be free flowing. And so here we have these antihistamines and we have blurred vision. So she took the sleeping ed. Now she can't see up close. Why can't she see up close? Because they block the nerves that normally help the eye focus. That's all there is to this question. It's like shrouded in the whole antihistamines. And so it's hard to parse out. But anyways, yeah, cool things in that question. I thought it was a good, hard question. Hopefully we broke it down and it made sense. So we'll see you in the next video.